Hi, Sid. How are you?
They call them the unseen.
Everything is good?
And all this is about getting to them.
Oh, beautiful. So today you have a 40 bags, right?
Yes.
To just go and drop the food and ask them how they are. And if they have any problem, anything, they can call us back.
Every Friday, a carload of donated groceries arrives,
Carrot, banana, everything is
Yeah,
free.
people.
and a team of volunteers is ready. They'll go door to door
Hi there, how are you?
to gently, persistently knock down invisible barriers.
Enjoy it.
Thank you.
And, says Aisha Cassie, deliver much more than food.
Thank you so much.
It's connection. Connection, see people face on face. We make observation. If this person is okay, we are not doctor, we are not like nurse, but we take a mini training and we know the sign of the mental health.
The signs can be hidden in this community of high-rises near Toronto's downtown core. St. Jamestown, like other low-income, densely populated areas where many essential workers live, has been hit hard by COVID. The infection rate here has been among the highest in the city. Harder to measure, but indisputable, the mental health toll that has come with it.
In this community, stigma is a huge issue. They are just thinking if they will talk about the mental health, they think the people, they will say them they are crazy. Don't worry, don't worry.
Surabi Kaur is a program director with Community Matters. She's worked in this neighborhood for 14 years and says the number of mental health related calls she gets has quadrupled.
They are struggling, they lost the job, and still when they are at home, many cases I heard they have a problem with the husband and wife, with the partner. It's the mental health and the stress, and it's pile up, and then
But she's most worried about those who haven't reached out yet, the ones behind closed doors.
But those who are sitting in the apartment, this is unseen. The people, they don't know how much struggle they are doing.
You call them the unseen. Like, how many do you think there are?
Many. I am just telling to you is many, They look okay when you see them, but they will talk to you, a months and months, and when they feel, oh, this person is kind of reliable, so then they will open. It's kind of neighbors helping neighbors.
Okay, Maya, where we gonna go now?
Building trust with the wary. The door-to-door strategy is critical because based on what people have disclosed, the need is huge.
Thank you very much.
Okay.
See you.
Bye.
Have a nice day.
Bye.
Hanan Mohammed and her daughter Ilhan are only now starting to talk about feeling as if they're in prison. Both got COVID in December, and since then, a sense of dread keeps settling in.
It's like depression, anxiety. I feel like I'm locked down. Like now, even I think about the people in the jail, how they survive there. Yeah, like I start thinking. I get like a lot of emotion. I never have this before. It was hard for me. Yeah, this year. Yeah.
How about for you? Did it have an impact on you?
Yeah, it was really hard. Just being locked in and like having to like forced to deal with like those dark thoughts in your head.
Did you find that COVID made that overthinking worse? Like having had COVID?
Yeah, cause then you're thinking like, am I gonna live? Something like everything's gonna be okay? Like did I like are we gonna be okay after this? Like is cause you like hear about all the bad stories about people dying and going to the hospital. So it was like really like scary to like living through that and like wondering what's gonna happen next. Yeah.
And did you reach out for help anywhere?
No, I kind of just dealt with it on my own.
Why didn't you reach out for help?
I don't know. I don't know. That's actually a good question. I don't know why I didn't do that. I actually don't know.
It is a unique intersection, a sense of defeat, even in the face of hope.
A number of them are newcomers. We have a 60% visible minority population here.
Nalini Pandalangat runs newcomers services at Sherburne Health. At a recent vaccine pop-up clinic for St. Jamestown residents, Nalini says a lack of paid sick leave, insecure jobs, and unstable housing are systemic inequities. The relentless pandemic pressure just kept adding to them.
There's a lot of anxiety and mental stress around these things, right? And added to that is the fact that a lot of them have families in their home countries, right? And lot of people dying, family members, so that is an additional kind of stress on them. So in all, it's taken a huge toll on mental health.
A toll that is only adding to a sense of isolation. Ranjana Banerjee works as a cashier at a grocery store. She's a widow and a mother too.
It's too much difficult for me because I have a 12-year-old son and I'm an essential worker, so I had to come to work. So he's doing online by himself. Yeah.
I remember
She's had her first dose of vaccine, but she worries about what could happen to her son if she gets sick.
I'm scared sometimes, like if I get sick, who will take care of my son? Because he's only 12-year-old. Like tomorrow what's gonna happen nowadays, nobody can say. The life is so different now. I don't know what's gonna happen. It's not same.
Vaccines are part of the way out, but the fear is still there now and in the days ahead.
I know post-pandemic is going to be more worst. So that's why I'm just preparing a different group, how we can create a social group, and they can come forward and they can also talk about how tough for them this situation and how they get the supported from each other and how they are going to take care of their family in the future.
Breaking down silence and stigma, it may seem an enormous task, but they're already trying, hoping every small, kind step gets them a little bit closer. Joanna Rumiliotis, CBC News, Toronto.